Hi everyone, I've been meaning to do this video for so long and I'm finally getting around to it. You know how life gets in the way. Yeah, anyway. So this one is going to be the first part of some series that I want to do, and I'm going to give you a short chemistry class. Well, not really chemistry, I'm just going to discuss the types of carbohydrates, and by the end of this part you'll be able to identify different types of carbohydrates, what makes them different, the glycemic index, and also what insulin resistance is. Sound good? So let's get started. Okay, carbs are mainly a chain of molecules. So you'll have longer chains, shorter chains. Some chains are stronger than others, just like necklaces. Some will be broken easily and some won't, okay? So just think of carbs as a chain of molecules. Examples of carbs are, like everybody knows, are refined grains and breads and cookies and cakes and chips and white potatoes and sweetened drinks and processed foods and sugars. We all know what carbohydrates are. But there are many foods that contain types of sugars. Now, why I wanted to talk about this today is because we have the holidays coming up. The holidays, we eat a lot of comfort food, which is a lot of starch, and we have a lot of celebrations of Thanksgiving and other Christmas and other religious festivities. So we eat. Part of the human experience is communicating with others is over food and drink, which is full of sugar, okay? So in carbohydrates, there are many types of sugar, okay? There's the table sugar, which is called sucrose, and that's fructose and glucose combined. There's fructose, which is the sugar found in fruits. There's lactose found in milk, maltose found in grains, and the plain simple sugar of glucose. There are three compounds that belong to the carbohydrate family. They are glucogen, starch, and cellulose. Okay, glucogen is your main source of energy, and it's stored in the muscles and the tissues, and it's there for when you need energy, like for exercise or some kind of movement. Cellulose is a fiber, and it's stiffer. It's more rigid bonding of sugars. It's harder to pull apart. It makes them unbreakable, so that makes them indigestible, and they go right through your intestines before they even get to the blood. So that's why fiber is good for you, and you should have, I think, about 24 to 30 grams of fiber a day. Starch. Now, starch, we all know what starch is. They're made up of individual glucose units. They're easily broken. They pass through your intestines and into your blood and spike your blood sugar. So the difference between, I'm going to just show you the molecular structure of starch, and the simple starch is at the top one. The difference is just where the molecule of the oxygen is placed. And the starch, the top one is easily broken. The bond on the bottom one is hard and resistant and is not broken, and that's your fibers. So the bottom line is that all sugar is all sugar, and unless you are an athlete or need a sudden rush of energy for some reason, it's best to avoid carbohydrates as much as possible. Now, we know carbohydrates are really sugar in different forms, so let's discuss what sugar can do for your body. Well, being it's the cold and flu season, and I'm sure your healthcare provider has talked to you about having a flu shot. And another good tip, I tell my patients, is, being that I'm a healthcare provider, is to increase your vitamin D. Make sure you're taking your vitamin D, you're having less sun, so you're going to increase your vitamin D requirements. Vitamin D also boosts your immune system. If you want to prevent cancer, your vitamin D level should be between 50 and 70. Okay, that being said, let's move on. Okay, so your immune system is policed by your white blood cells. Let's say they are the policemen for these systems. Vitamin C is the weapon for these systems. So the policeman is your white blood cell, and his gun is your vitamin C, right? Okay, so when you ingest sugar, and especially a lot of it, your pancreas produces insulin. Insulin's like a doorman knocking on the cell's door to let you know that sugar is outside for your cell to use. Without insulin, your sugar just floats in blood and it plays havoc with your tissues and your organs. That means the more sugar you ingest, the more stressed your pancreas is. It produces more and more insulin and is constantly pounding on those cell doors. Just like people, the cells get annoyed and stressed and downregulate their insulin receptors or close the number of doors for the sugar. So this is your insulin knocking on the door and the cells are saying, no, no, go away. Okay? This is called insulin resistance, when they're trying to close the doors on the insulin, and this leads to type 2 diabetes. This results in more sugar floating in the blood, doing more damage to your tissues and organs. Insulin also helps nutrients get into your cells. So with less doors open, less nutrients get into the cells, which I'll give 2 examples, calcium and magnesium. Calcium, a lack of calcium will lead to osteoporosis, and lack of magnesium can increase your blood pressure. So sugar can be related to this in this indirect way. And because these doors have been knocked on so long, they're actually getting boarded up. This is why it plays a role in these other diseases. First, the liver downregulates or actually boards up your doors of the cells, then the muscle cells, and then lastly the adipose or fat tissue. And the fat tissues are the last cell to become resistant, so fat continuously grows and stores sugar in the form of fat, and especially around your middle. Okay, now let's go on to complex carbs, because we all know we've been told complex carbs are better for you than simple carbs, okay? But why? Why is this? Because complex carbs are absorbed more slowly, avoiding spikes in blood sugar. And this is what we call a low glycemic index. Whole grains, fruits, veggies, legumes, nuts, seeds, beans, they're all low glycemic. The glycemic index is how fast your body converts carbohydrates and foods into glucose. So the slower it does that,